Hi everyone, how are you? Welcome to another question and answer session. This is the physiology portion of the MRCS exam. Here, this is the question. First of all, read the question very carefully. A 65 years old man is admitted for a below knee amputation. That means a patient undergone surgery. He is taking digoxin. Clinically, the patient has an irregular pulse. What would you expect to see when you examine the jugular venous pressure? So first of all, we have to know details about the jugular venous pressure, because we have to find out the change of jugular venous pressure in a patient who undergone surgery, which is a big surgery, below knee amputation, and the patient also taking digoxin. That means the problem of the heart. For this condition, digoxin is given, and this patient also develop irregular pulse. So we have to find out the one of the option which is occurs due to the irregular pulse in case of JVP or jugular venous pressure changes occur. Here the options are absent Y wave, slow Y descent, canon wave, steep Y descent, and absent A wave. So we have to find out a option of the jugular venous pressure which occurs due to irregular pulse. And here this is important that the jugular venous pressure, it is traced in the papers. So here we can see the definition: jugular venous pulse. What is jugular venous pulse? It is the oscillating top of vertical column of right internal jugular vein, and it reflects pressure changes in the right atrium in the cardiac cycle. So the jugular venous pressure, it's actually the pressure within the internal jugular vein, and this pressure change occurs due to any changes into the right atrium of the heart. So the jugular venous pressure, what is it? It is the vertical height of the oscillating column of the blood. So first of all, here we can see this is the right internal jugular vein. Here we can see here, this is the right internal jugular vein, and the pressure of this right internal jugular vein, it is actually pressure of the major of the right atrium. And here you can see the position of the patient. It is about 45° for measuring the internal jugular venous pressure. And here we can see the internal jugular vein, and this internal jugular vein, it is the continuation of, or it is derived from the, or it is drained into the superior vena cava, and this superior vena cava, it is directly drained into the right atrium. So any changes in this right atrium, it directly reflect into the internal jugular vein, and also any changes in the heart valve of this right side, and any changes in the ventricle also. And it is also remembered that this uh, blood goes to the lungs to this pulmonary trunk. So any changes in the pulmonary trunk and the valve here, and also the changes in the lungs, they may reflect pressure in the internal jugular vein. So the internal jugular vein, it directly reflect the any changes in the right atrium, and also the right valve, which is the tricuspid valve, also the right ventricle, also the pulmonary trunk or pulmonary artery, and also in the lungs. So the all changes represent the changes in the internal jugular vein. Here we can see the jugular venous pressures. So here we can see the tracing of the jugular venous pressure curve, and here we can see the some positive deflection and some negative deflection. Here this is the A, C, and B. They are the positive deflection. That means in this condition, right atrial pressure increase. So during A, during C, and then during V, the pressure within the right atrium increase, and during X and during Y, the right atrial pressure will be reduced. So first of all, here we can see the A curve, which is the A for atrial contraction. So A, this positive deflection occur when there is a right atrial contraction. Then when here we can see this is the C curve. C for closure. That means C, this occurs due to closure of the tricuspid valve. Here we can see the tricuspid valve. So when suddenly tricuspid valve, it closes, then slightly increase right atrial pressure, and then gradually decreases. And this C, that means this small deflection occurs due to closure of the tricuspid valve. And this V for it is the continuous inflow of the venous blood. So when the blood it enters into the right atrium, then this V reflection occurs. So A, C, and V is, I think it is now clear that the A, it is responsible for atrial contraction, C for closure, and V for continuous inflow of the venous blood in the right atrium after closure of the tricuspid valve and relaxation of the right atrium. And then here we can see the negative deflection, that means the pressure and blood it decreases in the right atrium, and also pressure decreases in the right atrium in this condition. So during AX, which is the right atrial relaxation, that means when the closure of the tricuspid valve occurs, after that for receiving blood, right atrium relax spontaneously. And this condition when right atrium relax but there is minimum blood or no blood, so their pressure suddenly reduce. And here we can see the Y, that means the passive impeding of the right atrium after tricuspid valve open. So when tricuspid valve open, then blood from the right atrium it enters into the right ventricle, and this condition as the blood leaves right atrium, then right atrial pressure reduces. So what is the X? X is occurs due to right atrial relaxation. And what is Y? Y when blood enters from the right atrium to the right ventricle. So now here we can see the abnormalities of the jugulovenous pressure curve, and here we can see absent A wave, that means atrial contraction. Here the atrial contraction, and atrial contraction occurs due to atrial fibrillation. We know that during the atrial fibrillation there is lots of movement, that means about 200 to 300 times movement of the heart muscle, but there is no effective circulation or no effective cardiac output. As there is no effective cardiac output, so no changes in the internal jugular vein, that means no extra blood into the, or no blood into superior vena cava, no blood in the internal jugular vein, and this condition absent A wave. And here we can see large A wave, that means right atrial pressure increase due to any cause. Here we can see a right ventricular hypertrophy. In case of right ventricular hypertrophy, right ventricular pressure increases and less blood enters into the right ventricle from the right atrium. In this condition there is a large wave. And also the tricuspid stenosis, in this condition also less blood leaves right atrium, so more blood in right atrium and right atrial pressure increases. And here we can see the cannon wave or extra large wave, it occurs in case of complete heart block. Prominent V wave, it occurs due to tricuspid regurgitation. Here we can see the V wave occurs due to inflow of the venous blood into the right atrium. So when there is tricuspid regurgitation, that means the some blood coming in the right atrium, and also the blood which should not come from the right ventricle into the right atrium, it also occur due to tricuspid regurgitation. And this condition right atrial pressure also increases, and the V wave it increases its magnitude. Then here you can see the slow Y descent. Slow Y descent. Y descent, that means pressure releasing very slow in the right atrium. It occurs due to tricuspid stenosis. That means the blood leaving the right atrium very slowly. Then a right atrial myxoma also. And steep Y descent, it occurs right ventricular failure, constrictive pericarditis, tricuspid regurgitation. And here we can see some irregular pulse. In this question there present that irregular pulse of this patient, and irregular pulse occur in case of arterial fibrillation and multiple ectopias. So here our answer is now ready, that clinically patient is irregular pulse, and we know that irregular pulse it occurs in case of atrial fibrillation. And in case of atrial fibrillation, what is the change of the jugular venous pressure? It is the absent A wave. Here we can see this is the absent A wave. So in case of irregular pulse, jugular venous pressure changes and it causes absence of the A wave. So it is all about the jugular venous pressure. It is one of the difficult topics, but if you concentrate, it will be easy for you and remember all the topics. And especially this slide is very important, that the different abnormalities of the jugulovenous pressure. Among this, first of all, absent A wave, it is the most important, then large A wave and canon A wave. So this first three lines is very important regarding the exam. Thank you all.